We're here with Dr. Stephen J. Pincus, and he is an expert in facial, head, and neck plastic surgery. Hi, Dr. Pincus.
Jill, hi.
Hi, I'm so glad that you're going to talk to us today about this fascinating subject because everybody wants to look great. And tell us a little bit about your background.
Well, I have my original degree in physics. Following that, I decided to go into medicine. And in medicine, I felt that the most creative aspect of medicine would be plastic surgery. So I became a facial plastic surgeon, which involves doing cosmetic as well as reconstructive surgery.
Not only that, but you're also a clinical associate professor at USC.
Yes, it allows the residents an opportunity to learn from doctors who are in the community, and they bring to these residents techniques and insights that they may not get in the university setting.
And you do work with facial, head, and neck, and you specialize in the nose. Tell us about the nose surgery. It's called?
Well, nose surgery is called rhinoplasty, and basically, after initial eye contact, the nose is the first feature that you see. And changing it can really have a dramatic effect on the overall look. I think it's probably one of the most transformational procedures I do. And it's probably the hardest facial procedure to do because
Why is that?
It's a three-dimensional structure. Unlike other plastic surgery that we do on the face, which is two-dimensional, planar, when you pull a skin in a facelift or eyelid surgery, it's just two dimensions, and you have a pretty good idea of how it's going to go. Every part of the nose that you work on can affect another part, so the more experience you have doing these procedures, the better able you are to anticipate possible changes and to avoid those changes if they would be unwelcome changes.
We were talking earlier about the 3 Ds of aging. Can you tell us about that?
Okay, well, the first D is descent of tissue. And to correct that, we do facelifts. Basically, we're just pulling things back to reverse the effects of gravity. The second D is deflation. And as we age, the fat tends to atrophy, basically go away. And what we do for that is we try to fill in the fat. And the third D is the deterioration of the skin, which takes place from sun exposure and other things such as smoking. And that's reversed by using special topical treatments. Chemical peels will reverse a lot of this, and certainly lasers will also reverse some of this.
Now, also, if somebody doesn't want to do a facelift, what's a little mini fix-it that somebody could do just to make themselves feel better?
Well, I usually ask the patient what really bothers them, and in many cases, if they do feel that they look older or more tired from their eyes, it might just be a matter of, let's say, removing some bags under their eyes, or maybe doing a brow lift, or even a browpexy, where you go through the eyelid and tack the brow up, which is a fairly simple procedure. Certainly, some people just look older because they've started losing some volume in their face, and in those cases, even just radius injection sometimes can help things.
I know a lot of people are considering facial plastic surgery. What would you say to them?
I would tell them that if I agree with what their concerns are, that it's valid, and that it will take the issue of something that's always been bothering them and make it disappear, basically, and that they will feel good about themselves afterwards.